Dr. Joe Canner. Both of them have received their COVID-19 vaccinations, their first injections this week, and they're going to speak on that and be available to answer your questions in just a few minutes. Obviously, with vaccinations starting here in Louisiana this week and around the country, this is an exciting time, and we all have a lot to be thankful for and optimistic about. And this is the beginning of the end. This is the beginning of our process to put this pandemic behind us. I did have the opportunity to see the first shots being given on Monday at Oxnard in Jefferson Parish. They're just about an hour or so after the vaccine was delivered on Monday morning. And then earlier today, I was at Our Lady of the Lake here in Baton Rouge as they distributed their first shots. And I was able to talk to a lot of healthcare workers who were receiving their vaccinations. Obviously, we're still in week one, and we're working with the hospitals to get their vaccine data into the system and include it on our COVID dashboard. And that does take some time. You know, for example, at Our Lady of the Lake a while ago, they were filling out paperwork, and then later that paperwork has to get inputted into the computer system and show up on links. But we can report that a minimum of 7,000 vaccinations thus far of healthcare workers has been documented on links. I believe the number of vaccinations greatly exceed that number. 71 hospitals did receive their doses this week. We did receive the full first week's allocation of 39,000 doses. Those doses came in on Monday, Tuesday, and Wednesday. And we are obviously in the first order of priority since these are the first vaccinations being given. Priority 1A includes frontline healthcare workers that are tier one hospitals. And by that, I don't just mean doctors, nurses, and therapists, although I certainly do include those individuals, but also other folks working at the hospitals, whether they are custodians or where they work in food service or engineering and different things like that, because they too come into contact with patients who have COVID, so they're at risk themselves. But this order priority also includes EMS workers, and EMS workers includes people who work at fire departments who make emergency calls, many of those related to individuals who are having problems with their health, or they've been in motor vehicle accidents and so forth. That priority also includes priority 1A, individuals who are either residents or staff at long-term care facilities, so nursing homes and assisted living centers. And all of these individuals will be vaccinated in priority group 1A, some with Pfizer vaccine that is actually starting to arrive this week, others with Moderna, and that process is playing out this week, much like Pfizer did last week. And in fact, Moderna's vaccine candidate is actually before the Vaccines and Related Biological Products Advisory Committee today, and they're voting as to whether to recommend the Food and Drug Administration issue an emergency use authorization. We think that that will happen because the data is very similar to what we saw with Pfizer, both with respect to efficacy and safety. And if it plays out like it did last week, then at some point over the next day or two, we should see the EUA granted. We know then the product will ship and start to be allocated across the country very shortly thereafter. And then the CDC, Dr. Redfield, will have his advisory committee meet, ACIP, in order to inform his decision on whether to issue the final green light. Likely these things will happen over the next few days, and we will have vaccinations in Louisiana and elsewhere around the country with the Moderna vaccine. We will not know the exact number of doses that we will get of the Pfizer vaccine next week until sometime tomorrow. And I do want to make sure that members of the press and members of the public know that we've been told to expect from Operation Warp Speed, in fact, from General Perna himself, who's running that operation, that going forward on Fridays, we will be given our allocation for the next week of each vaccine by type, and then we will put in our orders as to how much vaccine goes to which sites over that next week. And so before we get that number, we would be guessing if we tried to tell you exactly how much of each type of vaccine that we're going to be receiving, but we'll make sure that you all are updated when we know what next week's allocation looks like. I do know that there are a lot of individuals who are anxious to know when they or a loved one might be in line for a vaccination, meaning which priority group will they be in. I want you to know we don't have all of that figured out yet, and we are waiting on the ACIP recommendations, not just as it relates to each vaccine that comes forward, but also they are making recommendations to the states to form priority groups. And we are obviously receiving requests from all sorts of groups of individuals out there, of workers and so forth, that those workers be considered high priority. And many of them will be considered high priority. We just don't know. You know, for example, all of first responders, all of school teachers, and so forth. You know, that's how we're going to end the pandemic, is getting the vaccine to enough people, and we're going to have to do it in order of priority. But we really don't know yet what the recommendations are and what the allocations are going to be going forward, so we can't tell people exactly when that's going to happen. I will tell you that we will be focused in Louisiana on equity, and also we're going to be taking a hard look at the individuals who are in the hospital at any given point in time, and really that COVID patient census has been relatively stable in terms of what it looks like across the state of Louisiana. It looks like the rest of the country, for that matter. The older you are, the more likely you are to go to the hospital if you get COVID, and the longer your stay when you do go, and the more likely you are to die, and that's also true for people with comorbid health conditions. So we will be taking a look at that. And one of the things I wanted to show you is just how pronounced this is when you look at hospitalizations and deaths by age groups. And if you just take the 18 to 29-year-old group, and that's the baseline comparison group, as it relates to hospitalizations, if you're 30 to 39, you're 2 times more likely to be hospitalized and 4 times more likely to die. And then you go up another 10 years, 40 to 49. You're 3 times higher to be more likely to be hospitalized and 10 times more likely to die. And then 50 to 64, 4 times higher on hospitalization, 30 times higher on death. 65 to 74, 90 times higher on death. 75 to 84, 220 times higher. And of course, if you get 85 and above, 630 times more. So if we're trying to focus initially, as we are, on preserving hospital capacity and saving lives, then that's going to be a key component of the next order of priority, is to get to these older people and people with comorbid health conditions who are not in the congregant settings, who are going to be getting the vaccinations in priority 1A. But we've got a lot of work to do, and we're looking forward to the ACIP recommendation on this as well. I do want to turn it over to the speakers here in just a moment, but before I do, I want to go through today's numbers. Today, in terms of new COVID cases, we're reporting 3,506 new cases of COVID-19 on 36,553 tests. Very sadly, we're reporting 31 new deaths, and the death total there, 6,964. There are 1,602 COVID patients in hospitals across the state of Louisiana. This is up 18 from yesterday, but we also went above 1,600. And so we are now above the peak of COVID hospitalizations that we saw as a result of the summer surge. So that's an indication of where we are headed if we don't turn this around really quickly. And our hospitals are already stressed. That was a point that Katie O'Neill made to me today, Dr. O'Neill at Our Lady of the Lake. And that is in part because of the high number of COVID patients, but it's also because the non-COVID patient census today is much higher than it was either in the summer or in the spring. So we do have a lot of work to do in order to flatten the curve and slow transmission so that we can get these numbers trending back in a more positive direction. 169 of the hospitalized patients are on mechanical ventilators, and that's up 15 from yesterday. Earlier this week, I was able to speak to hospital CEOs and medical directors from around the state, and I can tell you they are extremely concerned with hospital capacity, somewhat as it relates to beds, but primarily about staffing. And that's another reason why the vaccinations that we're seeing take place across the state today are so critically important, is because if we can get the vaccinations to our healthcare workers and hospitals, then they aren't out either isolating or quarantining when they're needed at work to take care of COVID patients and other patients. And we know that we have a safe and effective vaccine that works 94, 95% of the time in preventing COVID, and as far as we can tell from the data, it works 100% of the time against severe cases of COVID. So this should help with that capacity at our hospitals and keep more of our staff on the job and at work. And I did have an opportunity to speak today with some healthcare workers who work on a COVID unit. And I will tell you, not just the ones I spoke to, but healthcare workers across the state of Louisiana have been true heroes throughout this entire pandemic. And I can tell you they're getting tired. And it is demoralizing and somewhat frustrating when they see multiple surges and seeing the worst surge of all right now in many parts of the state. But they are working tirelessly, doing a tremendous job offering life-saving care to the people all across the state of Louisiana, and I want to thank them. And as we all get ready to go through this holiday season and so forth, let's make sure that we lift them up in prayers and that we are properly thankful for all the efforts that they are making. Speaking of health care folks, we've got one with us right now, Dr. Davis, who I told you a minute ago is CEO of New Orleans East. She's also a member of the Health Equity Task Force that we created to address health disparities. And she's going to come up and speak to you, and I would ask that if you have questions for her, you direct them to her while she's here at the podium. She will be followed by Dr. Cantor, and likewise, if you have questions for Dr. Cantor, ask those of him while he's here. And then on the backside of Dr. Cantor's presentation, I'll come up, finish my prepared remarks, and then take your questions as well. Dr. Davis.
Thank you, Governor Edwards, for inviting me here this afternoon. This truly has been a historic week for New Orleans East Hospital, our LCMC Health family, and hospitals across Louisiana, as our healthcare system has been preparing and hoping, being encouraged that soon we would start to see a light at the end of the tunnel with this pandemic. Our healthcare teams are tired. We have been battling COVID-19 for 9 months. With New Orleans being an early hotspot, the New Orleans East Hospital in particular, witnessing how quickly in our state that many of our community members not only contracted COVID-19, but unfortunately succumbed to it. As I think back to March and April, when we were overwhelmed with despair and fear, the stress on our healthcare providers, we're seeing again now with this third surge. So the prospect of having a safe and effective vaccine has brought us hope as we continue to take care of our community. Hope has been high for many days as we anticipated the receipt of our vaccine. I am pleased to share with you all that LCMC Health received our first doses on Tuesday. Soon thereafter, there were doses going into the arms of our frontline healthcare workers, doctors, nurses, pharmacists, respiratory therapists, but as Governor Edwards mentioned, it's all of our frontline workers who are at higher risk. So that includes our environmental services staff, our dietary staff, our patient access staff, are all standing in line, excited and encouraged to receive this vaccine because we know all too well at New Orleans East Hospital what it's like to not just contract COVID-19, but unfortunately, our hospital was the first to lose a valued member of our team, Larice Anderson, at the end of March. So anything that we can do to ensure that we don't have to call any of our colleagues' kids and say that your mom or dad isn't coming home is what we are doing. So we stood in line starting on Tuesday to take the vaccine, and I am extremely proud to report that our healthcare workers are following in the footsteps of others in saying yes to this vaccine. Governor, I can tell you that these vaccines are met with tremendous excitement and emotion. We've had tears of joy, different from in March and April when there was tears of despair. Clapping, the result of this moment has been hoped for, and the sheer recognition of witnessing this history is important for all of us. I have seen firsthand people saying that this is a time in their lives that they will share not only with their children, but their grandchildren. These cards that we carry, those of us, myself included, who have taken the vaccine, are a card of pride that we are continuing to take care of our community. But I've also seen firsthand and heard firsthand, not just from colleagues, but family members, church members, about their concern and anxiety about getting the vaccine. They're concerned about the speed of the vaccine. But I stand here to tell you, as a Johns Hopkins University and Harvard University trained physician, that the science is clear. You can look it up yourself on cdc.gov. This is a safe vaccine with only having allergic reactions in a handful of individuals when we've seen thousands of doses delivered across not just the U.S. but the world. And that this is an effective vaccine, that 95% of those who received the vaccine did not contract COVID-19. And as the governor mentioned, it was 100% effective in preventing severe disease. So I stood in line to take the vaccine not because politicians or doctors on TV said that I should, because I looked at the data myself and said there are nearly 7,000 Louisianians who have died from COVID-19. Those are our family members, our neighbors, our church members that we couldn't save, but we now have the first of what we hope are many vaccines that can hopefully help us to prevent others from succumbing to COVID-19. So on behalf of New Orleans East Hospital and LCMC Health, I'd like to express a deep sense of gratitude, not just to our employees, but to all healthcare workers around the state of Louisiana for continuing to put themselves at risk before this historic week, continuing to come to work knowing that they too may contract COVID-19, but now standing in line, being the first and leaders once more for our community and taking the vaccine. This is truly an expression of healthcare with heart and what we do every day at LCMC Health. But it will be a while before all of us have the opportunity to get the vaccine. So I would be remiss if I did not remind all of you who are watching and listening that we still have to follow our public health measures to prevent the spread of COVID-19. That means continuing to mask up. Stay physically distant from those who don't live in your house, at least 6 feet away. Washing your hands often. Getting your flu shot, extremely important during this time. Flu still kills over 30,000 people across the U.S. And most importantly, remembering we are in a third surge. Christmas is right around the corner. I, too, would love to be able to celebrate with my family. It's my birthday. But it is important for us to wait until we are over this pandemic before getting together in large groups, even during the holiday. So we are here next year being able to celebrate not just Christmas, but all of the times that we love to get together in Louisiana. So please continue to follow those public health measures as we get more and more vaccine out to the community. Thank you, Governor and Dr. Cantor, Secretary Phillips, and the staff of the Louisiana Department of Health for your leadership throughout this pandemic in helping Louisiana and LCMC Health to get to this historical point. Thank you. I'll take any questions at this point. Yes.
What's the patient census at LCMC compared to the surge in March when it was particularly hard?
So we have seen an increased census at LCMC since the summer, but it's only about 20% of what we saw in the first surge. However, we saw a flattening of the curve significantly, as did all of our colleagues during the summer. And unfortunately, we have seen tripling of our positivity rates in our hospitals since Thanksgiving. So again, reminding everyone, our public health measures are key to flattening the curve until we can get vaccine out to the majority of our population and until we can flatten this curve again. We are extremely concerned about the stress that this third surge is putting on our healthcare system, on our healthcare workers, who are your neighbors, your church members, your family, and your friends, who have been working tirelessly 14, 16-hour days. We are begging you to help us help you by continuing to mask up and stay physically distant, and please do not gather in large groups for the holiday. Other questions?
One more. Have you seen any severe allergic reactions like you mentioned at LCMC?
So fortunately, we have not seen any severe allergic reactions as of yet at LCMC, but I do want to remind everyone that those severe allergic reactions we're talking about 1, 2, 3 thus far, when we have had several tens of thousands of individuals across the world who have been vaccinated. So while that is a part of the story, the greater tale is that we are protecting not just ourselves, but our community. But fortunately, thus far, we have not seen those severe allergic reactions. And personally, myself, I had a little bit of pain at the injection site. And other than that, things have been fine. Thank you.
Afternoon. Thank you, Dr. Davis. I want to thank you specifically for what you've done in the community. Dr. Davis has been just a tremendous leader in the New Orleans East community, a real convener, a real ambassador of health, and has made the New Orleans East Hospital really just a great place to receive care. So thank you for everything that you've done. And thank you, Governor Edwards. It made us all proud watching you, sir, at the White House a couple weeks ago to talk about vaccine preparations. And now to actually be here and be administering it across the state is just the most amazing thing. And Dr. Davis, just like you, I got my dose a couple days ago. I got it on Tuesday. I carry my card with me as well. I will do so every day until I get my second dose on January 5th is my date, my 21-day follow-up. So I think I had a very similar experience. I had sore arm maybe for that night. The next day, I felt just a little bit crummy in the morning, a little bit of a headache. Took a couple Tylenol the next morning, went to work, and then felt fine by the end of the day. And I feel fine today. I've been texting with a number of colleagues in the ER where I work, nurses and docs, who also got the vaccine on the same day. And that seemed to be the sense, is people felt a little bit sore, maybe a low-grade fever, nothing crazy, People took Tylenol or Motrin, and then it went away. So I guess for me, it felt pretty much like a flu shot that I get every year. And it was pretty emotional to be in the room receiving the vaccine. There were 2 different people I met in the room that got it at the same time who had lost loved ones to COVID earlier in the pandemic and were there receiving the vaccine. So it meant a lot to everyone there. For me, I reflected on my family, which is what's in it for me, and hopefully, that they can, my daughter and so forth, can enjoy the world free of COVID in the very near future. What I took away from that experience is, every single person that gets the vaccine from here on out, that's going to be a life saved, and that's going to bring us one step closer to putting this all behind us. And that, to me, that's really what's driving me forward. I wanted to mention, we got a little bit of a surprise from Pfizer. Pfizer put a little bit of Lanyap in the vials, and there's an extra dose here or there as hospitals are finding out, and we've been very clear with Louisiana that we don't want to waste any vaccine. So hospitals are using those extra doses. We're getting every bit worth of it that's being sent to us from the federal government, and we will continue to do so. As Dr. Davis mentioned, and I completely agree, we should make no mistake. This is a really exciting time right now because the end is in sight, but the road we're on is really rough, and we are still in the middle of a very dangerous third surge. Just today, we surpassed 1,600 hospitalized patients with COVID in hospital beds throughout the state. That surpasses the surge that we had in July and August, and we really have not a whole lot of signs that we're slowing. So this is dangerous, and it makes it worse because, number one, the weather's getting colder, so people are going inside. That's going to drive more transmission. Number two, it's the middle of flu season, and while it continues to be, thankfully, a mild flu season both for us and the country, that still puts people in hospital beds. Number three, we're on the tail end of Thanksgiving. We got the December holidays on the horizon. All of that is going to increase transmission. And more importantly, number four, as we've talked about a number of times in this forum, Louisiana is on our own. We're not going to rely or have available to us any medical assistance from the outside. We're not going to have the assistance of doctors and nurses and other professionals that we had come in before for the other waves, particularly because most other states are going through the same thing right now. So what we have is what we have, and we got to work hard to make sure it's not overrun. One of the big differences between the first wave back in March and April that Dr. Davis mentioned and now is that really was focused in the greater New Orleans region. Some other places, but really focused in the greater New Orleans region. Now it's spread really evenly throughout the state. And again, just like it's been the past 2 or 3 weeks that we have addressed, every corner of the state is experiencing increases right now. And we have no reason to think that it gets any better before it gets worse. So a couple improvements to the dashboard I wanted to let people know about. You notice on the home page, the map that shows parish by parish has changed a little bit, so I wanted to explain what was done there. The CDC, a couple weeks ago, but pretty recently, changed a little bit the way that they report incidents. And they previously had been reporting incidents, which is new cases per 100,000 residents, on a 2-week basis, 14-day incidents. And they changed to do it on a 7-day basis, 1-week incidents. So we did that as well. So now we'll be reporting incidents on a 7-day basis, 7 days per 100,000 residents. The other thing the CDC did, which we really liked, is they put some metrics behind what it means to be an area of high transmission, higher transmission, medium transmission, or lower transmission. They had been saying these terms the whole pandemic, but they actually put some good measures on so you can see where you live, where you fall on that. So we did that on the dashboard, and on the homepage you'll see a map of the state, parish by parish, and each parish will be color-coded based on the community transmission risk. And that's a combination measure. It in fact takes in 2 numbers into it. Number one is the percent positivity of that parish, of all tests conducted. And number 2 is that 7-day incidence per 100,000 residents. Those two combined go into that risk category, the color, and the higher of those two is what dictates that color. You might be confused if you look on the dashboard now because the entire state is red. Every single parish is in the highest category. Every single parish. So please take note of that. That's really where we find ourselves in right now. And again, looking forward to Christmas and New Year's, as much as we need everyone to be as vigilant and prudent as possible, we know it's going to drive some more transmission. And so we think that there are worse days ahead, at least in the short term. And we got to do all that we can right now to really tamp down. The one other thing I did want to mention is we're finishing kind of, as we speak right now, a really exciting partnership with Walgreens to bring on more testing throughout the state. And starting almost immediately, there'll be testing available in 32 Walgreens locations across the state. And folks can access that online. They can go to walgreens.com/COVID-19 testing. And there'll be an online algorithm, and it'll spit out the stores that are closest to you. It'll ask you for your insurance, just so that they can bill it if you do have insurance, but nobody will be denied it or charged if they don't have insurance. So all the other testing that we're doing remains. This is in addition to it, and we're really excited to have more options for people to get tested, because as we continue through this, particularly in the third surge, testing is really important. We can't fight what we can't see. So we encourage people to take advantage of that. And just to close, I'll just remind people, again, the end is in sight, and this is incredibly exciting, really, really exciting. But the road we're on right now is treacherous, and dangerous. And they say, the majority of your car accidents happen like a few blocks from your house. That's where we find ourselves right now. So we're working hard to get the vaccine out and to not waste a single drop. But for all of us, we got to be working double hard over these holidays to make sure we have no extra transmission. We got to keep the numbers as low as possible. I'd be happy to answer any questions. Yeah, Sam.
When do you anticipate having vaccine statistics on the dashboard or a dashboard, public-facing dashboard?
Hoping for next week sometime. Yep. Yep, sir.
Is there any estimate for how many additional doses that we're receiving because of mislabeling, as we described a little bit earlier?
Not really. It's not really additional doses receiving, and it's not really mislabeling either. It's when the vial gets filled at the manufacturer, sometimes there's some extra drops that get put in there, and depending on how it's drawn up or the size of the needle that's used to draw it up, you can, after you take your 5 doses out of the vial, there could be a little bit left over. So, I think this happens a lot with all types of medicine. I mean, it's pretty routine to have a little bit extra fill in the vial. We just don't pay a lot of attention to it because it's not, most of the medicines we use in the hospital are not as scarce. So this is very new. I mean, like in terms of the COVID vaccine issue. So we don't have a good sense yet from the manufacturer if there's any way to calculate or predict exactly how much. We're going to be working, closely with the CDC and the FDA to get that type of information, because it's going to be important to us to make sure we have enough dose available for the follow-up dose for people that get these doses. We're referring to these extra doses as angel doses. So we're going to make sure that they have doses reserved for them for the follow-up. But at this point, we don't have a better sense in terms of how to predict or calculate how much Lanyap might be in there. All right, thank you.
Thank you, Dr. Davis and Dr. Cantor. When I was at Our Lady Lake earlier today, speaking to the pharmacist, when they take the saline and dilute the vial of vaccine, every one of those that he did had a 6th dose. And what we were told to expect in the allocation that we received is based on 5 doses per vial. But it's not always going to be the case, and it depends on the gauge of the needle that you use to draw it out, and there's some other things going on there. But where it happens, at least with respect to that vial, that's a 20% increase over and above the allocations we expected to receive. Now, that's not going to be 20% across the board, but it is welcome news, and we want to make sure that we are using all of the vaccine that we have available to us. And to get back to Sam's question to Dr. Davis, you asked about New Orleans East, and I do want to tell you a couple things about that. Their non-COVID patient population is, census I should say, is higher today than it was back in the spring and in the summer. But secondly, if you go back to March and April, you know that the highest growth rate in case incidence anywhere in the country was the New Orleans metropolitan area. And so you would expect that they had a very significant hospitalization then, and in fact they did, and more so than now. However, statewide, I can tell you we have more people in the hospital today than we've had at the height of the summer surge. And I was told today by Dr. O'Neill at Our Lady of the Lake that just yesterday they admitted more patients with COVID-19 than they have on any day during the pandemic. So I don't want people to be misled into thinking that because the patient census at New Orleans East with respect to COVID-19 isn't at an all-time high, that's representative of what's happening around the state. It is not. So I just wanted to clear that up. Dr. Cantor mentioned a new partnership with Walgreens. We're excited about this. Of the 32 locations, I believe that there will be drive-through testing at 19 of those, and this will greatly expand the number of places and the variety of locations of places where people can get COVID-19 testing on a drive-through basis, 7 days a week. And while we're still going to utilize the National Guard for high-volume testing sites in the communities, this partnership is going to help us, I think, to further stabilize and expand our testing capacity. And it will also mean that as we need to do it, we can use the National Guard for other things related to, for example, vaccinations and so forth. But we will still be doing community testing out across Louisiana using the National Guard. And if you happen to be in a rural area that doesn't have a Walgreens close to you, you can always call the parish health unit. If there is a health center, they're going to have testing available. Hospitals are going to have testing available, and so forth. Remember, you don't have to be experiencing symptoms in order to get tested. One of the reasons why this disease is so hard to contain is that 40 to 50% of the individuals who get it do not show symptoms, but they are contagious. And so they go on with their lives, and they don't know that they have it, and they are exposing others, especially if they are not adhering to the mitigation measures that we've been calling for many months now. And these are all White House Coronavirus Task Force recommended mitigation measures, CDC measures, and so forth. Critically important. So you don't have to have symptoms before you test. And while we think up to 50% of all cases are asymptomatic, it is now clear that more cases are caused, spread from people who are asymptomatic, more than half of all cases out there. Which leads me into the next point. We are 1 week away from Christmas Eve. And the numbers that we are seeing, we've been talking about, are extremely concerning. Dr. Davis talked about the third surge. The third surge started in the month of November. We superimposed on top of the fall surge a Thanksgiving surge. We're still dealing with that. And there's a very real possibility of a Christmas surge being superimposed on top of that, while we're already at a very high level of positivity, of cases, of hospitalizations, and deaths. And so we really don't want that to happen. And I am encouraging everyone to be mindful of the CDC recommendations with respect to not traveling this holiday season if you can at all avoid it, not having normal holiday-related activities, and certainly having those indoor gatherings where people from multiple households come together for extended periods of time and multi-generational settings, because we know that is very conducive to the spread of the disease. There is no doubt, and in fact, I absolutely know that Christmas is going to be much sadder for families because they lost loved ones because of what happened during Thanksgiving. We don't want that to happen again. Nobody should want that to happen again. And obviously I can't speak for everyone, but I personally know more people around the state of Louisiana with COVID-19 active cases today than I have known at any point in this pandemic. And what that means, and I know that that's anecdotal, but that confirms to me this tremendous degree of community spread that we have, that is reflected in the percent positivity, it's reflected in the cases, it's reflected in the hospitalizations. And so what that means is you really can't have gatherings of any size without a substantial likelihood that one or more people there are going to have COVID-19 and they're going to be contagious. And that's true regardless of whether you're related to them. It's true regardless of whether they're your next door neighbor. COVID doesn't distinguish on the basis of those things. And so I am imploring everyone to be very, very careful. If you're planning today on a Christmas or a Hanukkah or a New Year's Eve that looks like previous holiday experiences, quite frankly, you're making a mistake. Please don't do that. Celebrate with the members of your immediate household. Stay connected with others by phone, by Zoom, however you can do that safely, but please don't gather for extended periods of time. Wear a mask, social distance, wash your hands. Outdoors is always safer than indoors. Pay particular attention to those who are vulnerable. And if you are one of those people who are vulnerable because of your age, and I showed you the chart a while ago as it relates to age, but also if you have one of those comorbid health conditions that predisposes you to a poor outcome should you contract the disease, whether it's end-stage renal disease, heart disease, diabetes, high blood pressure, obesity, please understand that you're much more vulnerable. And for all individuals with these comorbid health conditions, and if you're 65 or older, the White House Task Force recommends that you not go in a single indoor place outside of your immediate household if there is one or more individuals who are not wearing a mask. I want you to think about that. That's not the kind of guidance they've been given throughout the pandemic. That is reflective of the high degree of community spread that they're seeing here in Louisiana. And I will remind you that is state-specific guidance, but they're seeing it across the Sun Belt and in most parts of the country right now as well. I also want to remind people that you cannot test your way into a normal holiday experience and think you're doing it safely. Because a test is a snapshot, and you may have already been exposed, and you may be in the process of developing the disease. But you don't test positive because you're not shedding enough virus at the time that you're tested, and so you get this false sense of security that you can, and especially if you have others who are coming together, go out there and get tested, they have a negative test, and then you all get together and you think that's safe. It is not. And I absolutely know that people gathered together, multiple generational family members from different households coming together at Thanksgiving on that basis, and COVID-19 was present, it was spread, it was contracted, and some very unfortunate results from that. And one of the reasons I mentioned that, and it's a good thing, and the more we test, the better the visibility we have across the state and in every community. But right now, we're on the 17th day of December, and I think we're right at 550,000 tests that we're reporting in the month of December. We've never been that high before. And it tells me some people may be thinking they can test their way into a normal holiday experience. And I'm cautioning you that is wrong. That is inconsistent with the science. It is inconsistent with the recommendations. And quite frankly, it's inconsistent with what we know was experienced by too many people at Thanksgiving. So please don't make that mistake. Despite all the challenges that we've had in 2020, and there have been many, the pandemic is what we've been talking about thus far, but we had multiple hurricanes and still have people whose lives are upside down because of those hurricanes, especially Hurricane Laura. We have much to be thankful for as well. And this week I am certainly thankful for the vaccine that is here. I look forward to more vaccines arriving over time, and that more than just the vaccines, the vaccinations, because that's how we're going to put this pandemic behind us once and for all. And between now and when that happens, and it's going to take a number of months, I'm asking everyone again to please be a good neighbor. Understand you have a role to play. And the decisions that you make and the way that you behave isn't just going to determine whether you are more likely to contract COVID, but your loved ones and people that you don't even know when you come into contact with them. So let's all do what we can. Let's all play our part. Let's all be a good neighbor. There will be an LPB special tomorrow night at 7 o'clock statewide. I think it's going to air again on Sunday evening as well. And this 30-minute special is being made available to news stations across the state of Louisiana. But it was filmed yesterday. Dr. Cantor was nice enough to participate in that, as was President Verrett from Xavier University, who is a pharmacist, and then we had Dr. Tina Stefanski from the Region 4 Medical Director position at the Office of Public Health. They were all on an expert panel talking about the vaccine and what people can expect. So I would ask that people make sure that if you have any questions or concerns about the vaccine, that you take a look at that. And then over time, make sure that you are sourcing your information as it relates to vaccines and COVID properly. Not everything on the internet is accurate. Not all sources are equally credible. And I would encourage you to go to places like the CDC and like the FDA, like the Louisiana Department of Health, in order to get your information. I am aware that the current Phase 2 proclamation expires on the 23rd, next week. I will be meeting with our folks early next week and making an announcement in advance of the 23rd as to what that next proclamation will look like. If you just look at the data that we've been presenting daily on the dashboard and at these press conferences, you should know that we're not going to be lessening restrictions for sure as we get past December the 23rd. But specifically what that will look like, we will make those announcements on next week at our press conference. And I'm not sure yet whether that's going to be Monday, Tuesday, or Wednesday, but we'll let you know. And with that, I'm going to stop and take a few questions. At this, yes.
Governor, we know Bessie, or state education leaders, sent you a request that teachers be included in first priority groups. Can you talk about what other groups have sent you requests and kind of what you're grappling with?
It would be easier to talk about the groups that have not sent a request. There's tremendous interest in the vaccine, and that actually bodes well for us as we move forward, because we do need people to be vaccinated in large numbers. And as I mentioned earlier, we don't yet know what our future allocations will look like. We don't have any ACIP recommendations beyond Phase 1A, which we're currently in, as to which groups need to be vaccinated next. I strongly suspect that it will include those individuals that we were just talking about who are advanced in age and have comorbid health conditions, but it will also include perhaps people by occupation, whether they are school teachers, first responders, and so forth. And we're going to be taking a look at those recommendations. We'll be looking at the information we have in state as to who it is that's going to the hospital and so forth. And we're going to come up with our priorities beyond 1A. But we're just, quite frankly, we're not there yet. It's not that I don't believe any groups are important. They're all important, and quite frankly, none are more important than others in terms of their own livelihoods, but some occupations by definition will come into contact with individuals who have COVID more frequently than others, and so forth. And so we're going to be taking that into consideration. But there's a lot that has to go into that. But we will have more information later, and quite frankly, I'm just not in a position right now to speak to what the future priorities are going to look like. Any other questions? Well, I want to thank you all. Again, we will, I think we had thought this was going to be our last press conference for the year, but it won't be. We're going to have one next week, and if necessary, we'll have one the following week as well. But next week, we'll obviously be focusing on upon the proclamation that will come into place on the 23rd of December. So again, I encourage people to be good neighbors. Let's all do our part. Let's lift one another up in prayer, and let's look forward to a 2021 that's going to be much better than 2020. But how much better and how soon we can get to a better place really will be determined collectively by the people of Louisiana and by our country. We have flattened the curve. We've slowed the spread before. We can do it again, and it's the exact same measures that are required in terms of mitigation, masking, distancing, washing hands, staying home when you're sick. These things work. We need people to do those things, to embrace those things, and quite frankly, we need people to do better collectively than has been the case over the last several weeks. We know that. And we certainly need people to be mindful of all of this as we conduct ourselves over the course of this holiday season. And so with that, I'm going to wish everyone a wonderful weekend. If I don't talk to you again before Christmas, have a wonderful, blessed, and Merry Christmas. And then let's look forward to a much, much better 2021. Thank you all, and God bless.